Good morning and welcome. We'll get everyone a minute to get in there. Okay. Thank you, everyone. Welcome to Let's Chat About, the free monthly webinar series hosted by Hope and Focus. We've developed the series with those living with LCA and IRDs in mind, but it is open to anyone who is interested in what's happening in our communities. My name is Courtney Coates, and I'm the Director of Outreach and Development for Hope and Focus. Before we get started, I want to take a moment to thank our sponsors for this series. They are AGTC, Dominion Energy, Editas Medicine, Janssen, Mira GTX, and Spark Therapeutics. We could not provide programs such as these without their support. A few quick housekeeping items. This session will last about 45 minutes. Your microphones have been muted and your cameras are off. You can submit questions through the Q&A function, and as time allows, we will take any questions that come in live. We are also recording this session, and after the webinar, we will post the recording to our YouTube channel and send out the link. It is my pleasure today to welcome Kathleen Hayes of SmithSolve. In March, Hope and Focus partnered with SmithSolve to develop a community survey to better understand the needs of people living with and affected by Leber congenital amaurosis. We crafted the questions to draw data on disease education, genetic testing, patient registries, support groups, expenses, educational resources, current care, and more. We also partnered with Engage Health to host the survey, keeping the data anonymous and assess the results. The survey was distributed in April and May and resulted in 50 responses collected. We plan to use the insights gained from this to better serve the LCA community. After today's presentation, an accessible PDF with the high-level results will be shared, and Ben Shaperman of the Foundation Fighting Blindness will be writing an article on the overall findings that will also be accessible and shared out to everyone. Please join me in welcoming Kathleen to walk us through the results.
Thank you, Courtney. I'm happy to be here.
Thank you. So Kathleen, can you tell us about SmithSolve and your experience in rare disease?
Sure. So SmithSolve is a health communications company that specializes in patient engagement, patient advocacy, corporate communications, you name it. SmithSolve does have deep expertise in rare disease. I actually hadn't had the opportunity to work in rare until I joined SmithSolve late last year, but my own background is in public health, primarily in chronic viral diseases. But I really enjoy working in rare, and even just to hear and learn from those impacted by rare disease is just extremely motivating and moving for me.
Thanks so much. So how does our response rate compare to some of the other surveys that you've done in rare disease?
Yeah, so rare disease is a little tricky. In general, survey response rates around 25% is pretty typical. 50% would be on the high end, 10% would be on the lower end, but in rare disease, it's just really difficult to measure because of prevalence. I mean, some rare diseases meet the classification of less than 200,000, but others may be 1 in 50 or 60,000 people. So because of that variation, it's just not as easy to gauge. And then we have, a lot of other variables at play as well, like how long is the survey? How many questions were included? How long does it take somebody to complete the survey? So all of those things matter. And this particular survey, we had over 30 questions, right? So we covered a lot of topics. We had 50 respondents, which I think, given the broad scope and the number of questions, I think there's still a lot to learn from that number.
Awesome. Thank you so much.
Sure.
So that being said, I know you have some results to share with us. So would you mind walking us through?
Yeah, absolutely. So I just want to start off by thanking you for kind of setting up the stage and kind of providing the background information about the survey. I just wanted to delve a little bit more into the demographics of the survey respondents. So we saw that over half of the respondents were a parent or a guardian of a child diagnosed with LCA. And then about 36% of the respondents were adults 18 years of age and older with an LCA diagnosis. And then the other groups included maybe a spouse or another family member, such as a grandmother. So the respondents were represented by 14 different countries, which is pretty amazing. So the US, France, Germany, Poland, India, South Africa, Belgium, all over the globe. But most were, I think there was about 75% were US based. So that was just a little bit about where the participants came from. About 60% of the respondents identified as female, and then within the US, most identified as Caucasian, and ages ranged from 1 to 85 years. And just to go a little bit into the diagnosis, in terms of the amount of time it took to receive a clinical diagnosis by age, it was interesting to see that for individuals born before 1975, an LCA diagnosis took 13 years on average. However, for individuals born before 2015 and 2022, a diagnosis took just an average of 6 months. So that was pretty interesting.
I think that was a big point for us coming out of the survey, was seeing that data that showed the improvement amongst coming to a clinical diagnosis a lot sooner in life.
Yeah, I mean, I think that's a good sign, right? Like it's telling us that we've made some pretty significant advances, historically speaking, in reducing the amount of time it takes to get a diagnosis, which can impact a lot of other things, you know, in terms of being misdiagnosed, or, you know, also just helping to ensure that families and caregivers can be equipped with information earlier, I think is really important.
Yeah, absolutely. And it just like hits home the point about genetic testing and how important that is.
Yep. Mm-hmm. And we'll actually go into genetic testing here in a little bit. Following a diagnosis, most participants felt that when they did receive a diagnosis that they were provided adequate information and that the provider knew and understood and explained the information adequately. So that was good to hear. It was asked of participants where they typically sought education following a diagnosis, such as providers or online or through local community organizations or somebody else impacted by LCA. And we found that most seek education online or through nonprofit groups or advocacy organizations such as Hope and Focus.
I'd like to hear that.
Yes, yeah. We asked about the particular types of information that was sought after following a diagnosis, such as there was a lot of different options like therapy development, support services, technology, and the topics that were specifically highlighted were LCA progression and then available treatments, along with any information related to clinical trials. So that was useful. We then looked into more general education information, not necessarily around diagnosis or immediately following diagnosis, but more so just on research or general medical updates. And we found that online or through nonprofit advocacy groups, again, was the most commonly selected. And other questions that were posed for educational resources include preferred methods to consume information related to LCA research or maybe some community news. And we found that webinars or virtual events and social media were the most common ways to consume that information.
Yeah, I think we're finding social media to be a great platform for people to connect with one another.
I think it's made a huge difference, just diseases don't know borders, right? So I think any way that you can find others and to get accurate and helpful information is great. The community was asked about what particular LCA related topics were of interest, such as symptoms, mental health resources, patient stories. And again, we saw a trend there towards clinical trials, current research, available treatments, advocating for research and treatment options were to be of particular interest, similar to what we saw with the topics immediately following a diagnosis. Courtney, did you want me to take questions now or wait until the end? I'm just kind of going through everything and then.
Yeah, we'll definitely do some questions at the end so
Okay.
that we can get through the bulk of the data.
Okay, great. I know I'm covering a lot of information in a short period of time, so I just wanted to make sure.
Yeah.
So to go into genetic testing, that was another topic that was brought forward in the survey. We saw about 92% of individuals with an LCA diagnosis were noted to have participated in genetic testing. And the small percentage of those who had not participated in genetic testing were interested in hearing or learning more about it.
Yeah, it was really great to see those numbers come back so high around genetic testing because it is so important.
It is, yeah, and it's helpful to learn about, the specific mutation, which is, can help those affected by LCA and also researchers.
Absolutely.
Most participants indicated that they had learned about the option of genetic testing and also where to go to receive genetic testing through their eye doctor. And then most received the testing itself through a nonprofit program, such as the Foundation Fighting Blindness or other testing programs or research facilities. So moving into the topic of current care, we asked the community where care related to their LCA is typically received, and the majority noted that they received care through their local specialist and that these visits were typically covered through private insurance and then by Medicaid and Medicare. A few respondents did note that they actually don't receive care related to their LCA, which was a little bit surprising.
Yeah, is that typical amongst rare diseases?
No, I don't think so. I believe that most patients seek regular care. I think that they want to keep their information up to date with their provider's office in case a clinical trial opportunity comes up or if there's any related conditions or comorbidities that arise. So yeah, I think that was a bit of an anomaly for this group.
Yeah, it's great to understand why.
Yeah,
And
absolutely.
it might be, because it is a different lifestyle living with a visual impairment, but it is a really important part of continued care and as clinical trials come to be.
Mm-hmm. Yeah. So I am just moving right along into research participation. So that was another topic that was covered. Over 60% of the respondents noted that they do participate in a patient registry, such as My Retina Tracker. So that was good to see.
Yeah, and some background, we did distribute the survey to those in My Retina Tracker. So there may have been a little bit of bias there as we utilize that as a way to have participants. So I'm sure that's part of it, but it's always good to hear.
Yes, yeah. And then in addition to the patient registries, we asked about interests and motivations regarding participating in clinical trials. And Survey respondents did cite interest in taking part in clinical trials, with the primary motivation being to restore vision. So clinical trials definitely came up a few times throughout this survey.
Mm-hmm. Yeah, and it's obviously a huge part of what we do here at Hope and Focus is, encouraging those to move forward and supporting treatments. So it's been great to understand a little bit more where people's hesitations are as well.
Yeah, so many of the respondents actually indicated that in terms of concerns related to participating in a clinical trial, that they didn't have concerns, but of the respondents who did have concerns, what primarily came up was adverse events, efficacy, loss of existing vision, and then the cost of participation. So those were some of the concerns that were brought forward.
Yeah, which will be great to have some further education around that.
I agree. So we also asked about support groups, and this was the last primary section that was covered in the survey. 92% of respondents indicated that they do not participate in a support group, and it was noted that this was primarily due to lack of awareness. So that was interesting. And then even moving out more broadly, not just LCA specific, but support groups related to general vision loss. About 76% noted that they don't participate either, also from a lack of awareness or not having enough information available.
Yeah, I thought that was an interesting point. And, seeing as there are some desire there, it'll be interesting to try to get more information out there about what resources do exist. Um, do you think that they might be defining participation differently?
It could be. Yeah, it could be. And then I think that, we have to consider the pandemic and how that impacted at least in-person support groups. And, it seems like, and this would be something that could be interesting to see, is for like social media groups, Facebook groups, if there's already a large community that corresponds with each other there, that could also have an impact if there's other support groups that may not be as utilized.
Yeah, I'd be curious to know whether they consider Facebook groups to be a
Yeah,
support group or not.
right,
It's
right.
not what you might traditionally think of, but it is a way of support.
Yeah, yeah, that would be interesting to see. And we also asked caregivers this question, not just individuals with LCA, but caregivers themselves. And 40% do actually participate in a support group, and then 62% noted that they do not, and it was for the same reasons. So all across the board was lack of awareness or not enough information.
But definitely seems like those caregivers are seeking some more support.
Yep, compared to the other groups.
Mm-hmm.
So I went through that extremely quickly. These were the primary findings for the survey. I just hope that the information can be useful for material development and just to kind of help point out some of the focus areas that were brought forward from the community.
Yeah, no, we appreciate it. And just another follow-up question for industry and other advocacy organizations that might be listening in. What do you think some of the key takeaways are from our survey?
Yeah, I think that there's definitely a desire for information, especially related to clinical trial, available treatment options, the topic of how to get involved or how to advocate was brought forward. So it seemed like those were big areas that I think the community asked for.
Yeah. And another question that came in on the Q&A, SmithSolve as an agency that works in this area, do you know how we can reach people with LCA who don't receive care for it?
Yeah, that's a great question. I think we would need to work with community leaders and kind of look into more information about why that's happening. I think the survey was helpful to learn that this is occurring, but not necessarily why. So I think we may need to dig into that a little bit deeper, maybe have some advisory boards and just kind of learn what's going on there.
Yeah, absolutely. And I think, hopefully specialists and centers of excellence can help us with that as well.
Mm-hmm. Yep.
We always have outreach issues as well. We work with Lions clubs through Hope and Focus, but it is always consistently a tough thing to nail down. But we're going to keep trying, and part of what we're doing through this survey and through this exercise is that we are going to be making some changes to our website, because it is a really important resource when people go searching for more information. That can be a way for them to land and to get connected and understand the importance of being connected with patient advocacy and what that could potentially mean for them. So we are going to be taking the data from this survey and incorporating that into a new format and updated resources for our website to maybe more clearly outline some of the things that people are looking for that we have been working on over the years. And we're really looking forward to that, and also partnering with clinicians and just getting out some more general awareness about the resources we have available.
That's exciting. You're already using the survey results.
Yeah, we're getting some more questions in, so I'm gonna put those out there. From Ben Chaberman, I think it would be interesting to know where patients are getting a diagnosis. Are they getting it from an academic research center, a private practice retina specialist, a pediatric ophthalmologist, which I do think might have been one of the questions we asked in this survey, if you have that information.
Yeah, let me see. I think it was through their local eye specialist, but then I know that's also where the genetic testing came up. I may need to, let me make sure I answer that question accurately, and I can get the data for that specifically.
Okay, yeah, that would be great. Another comment that came in was that sounds like perhaps state services for those with low vision or blindness could be of help to those not getting care.
Yeah, we did see respondents note about using Medicaid and Medicare, but also the trend to go towards nonprofit and some of the more local or state services. So I think that is definitely somewhere that they go and could be further explored to kind of use to share information.
Yeah, and just getting, our materials there for them to connect with.
Mm-hmm.
Getting back a little bit to the point about the survey respondents citing interest in taking part in clinical trials, and their main motivation was restoring vision. This is really relevant when it comes to developing treatments that are meaningful for individuals, because they are really looking for some restoration of vision. And can you speak to that at all?
Yeah, that was, let me actually pull up that particular slide. That was rated significantly higher than the other motivators. A few of the others included, which I think I actually mentioned, efficacy, to develop therapies to prevent further vision loss, and then just general treatment options. But vision restoration was like 70%. It was pretty high.
Yeah. And while we're not showing slides during the webinar, we will be putting out the results after this so that people can kind of see how those ranked in an accessible way.
Great.
Do we have any more questions from the audience? Just want to give an opportunity to everyone. You can use either the chat function or the Q&A function. Question, how is Hope and Focus going to use this data? So I spoke a little bit about our website. We are currently seeking funding for a project to update our website and to make it more streamlined for individuals and caregivers affected by LCA. We are also planning to reopen the survey to collect additional responses. While we recognize that the 50 responses we received was a good number for a rare disease, we want to make sure we can capture as many opinions as possible. And so we are going to put that link in the chat, and we will also be distributing it on our platforms following the webinar today. And anyone that hasn't had a chance to take it yet, we would appreciate you taking the time to do so. The feedback and the results from this effort are really important for the insights in our LCA community. Do you have
they have
any other last words, Kathleen?
I just want to make sure that they were given the link to complete the survey. Was that sent out?
We are going to be putting it in the chat, and then we are also going to redistribute it on our social media and email channels as well.
Great.
One last question that squeaked in here. Can you speak to the role Luxturna might have played in the survey responses about restoring vision? Seeing that we do have an existing treatment that has had some restoration of vision, do you think that might have skewed answers?
Mm-hmm. That could have. That would be interesting to kind of dig a little bit deeper in for the responses who, for the respondents who actually selected that answer. I may need to go because we had some of the questions had open text box, so I could see if there were any comments of that, but I don't recall anybody mentioning that specifically.
Okay, thanks. Okay, so the survey link is now in the chat for anyone who would like to still take the survey. We will also have it on our website. You can always email us at info@hopeandfocus.org, and we will make sure to get you the link. We're looking forward to trying to get some more responses and really getting a good view of our community. Do you have anything else to add, Kathleen?
I don't think so. I just appreciate you having me here to share this information, and I will follow up with the one piece of data that I need to dig into, and just thanks for everybody for taking the time to listen in.
Yeah. Thank you all for joining us today. We really appreciate it. And as a reminder, we're going to have a couple of different things coming out. We're going to have our one-pager fact sheet that's going to have the higher level results. Foundation Fighting Blindness is also providing a written summary of the results that we will be sharing on our platforms. And any other data, we are always happy to dig into any questions if you want to email us at info@hopeandfocus.org. Let's Chat About will be taking a short break over the summer for July and August, but we look forward to coming back with more webinars this fall on a variety of topics relevant to LCA. And if you haven't signed up for our newsletter yet, you can do so on our website. The link is in the chat. And that's where you can stay up to date on all of our happenings here at Hope and Focus. So thank you all for being with us today. And thank you, Kathleen.
Thank you.
Have a good day, everyone.
Bye-bye.